The goal of the American Heart Association is ambitious, and part of it is to decrease death and disability from stroke and cardiovascular disease by 20%. But the American Heart Association has shifted its philosophy, in part responsive to patients, to healthcare advocates, and the general public, to realize that it's not enough to be free from cardiovascular disease and its ravages. We're really emphasizing healthy living.
Atrial fibrillation is currently common. It affects roughly 2.5 million Americans. Within the next decade, that number could double unless we do more to prevent it.
First, atrial fibrillation is associated with a 5-fold increased risk of stroke.
But it also impacts on the patients in many other ways. For patients who have symptoms, they can be aware of palpitations, they can be aware of less efficient function of the heart. There are a group of patients who don't have any symptoms at all, and this is perhaps up to 50% of people, and they're among the most worrisome because they don't seek medical attention. The AFib might be noticed incidentally at the time of an examination for an annual physical, but it also might be noticed when they present with a stroke.
And not only is it associated with an increased risk of stroke, it's associated with an increased risk of stroke that leads to significant disability and even lethal strokes. We could be doing better. We don't have the kind of outcomes that we want. And all of us are becoming increasingly aware there's this gap. What causes atrial fibrillation? Who's at risk for going on to develop atrial fibrillation? Which person that has atrial fibrillation is at the highest risk of having a complication from atrial fibrillation?
Well, there's a lot known about AFib. There is a lot that's unknown as well. And we've had a group of experts assemble in June of 2010 in Washington, D.C., really to look at the research agenda for atrial fibrillation from many perspectives.
The American Heart Association is one of the principal scientific organizations in the cardiology community. And when they perceive a need, when the Heart Association perceives a need to really address what are research gaps in a given field, they will accelerate the research agenda by calling together experts in a field to really think deeply and across disciplines about how to forward, how to make progress in atrial fibrillation research so that we can prevent atrial fibrillation and its complications.
The Research Summit on Atrial Fibrillation has a publication which is coming out in circulation in the very near future. It will summarize all of the basic epidemiologic, translational, and clinical knowledge gaps in atrial fibrillation research. For anyone who takes care of individuals with atrial fibrillation, is involved with education of patients with atrial fibrillation or research, this is an absolute must read.